Hi, my name is Jenna Anjali. I'm going to show you a series of exercises today for the SI joint. They can be really effective for general pain and instability. Here's a dowel. If you don't have a dowel at home, you can use a broomstick or some sort of pole. And I'm also going to use a magic circle. You could use a ball and a TheraBand if you don't have a magic circle at home. So the first exercise I'm going to start with is laying on my back. So I'm just going to put the dowel aside for now. And I'm going to take the magic circle and place it between my knees. So I just want to lie on my back. My heels are going to be right in front of my sits bones. I put the magic circle between my thighs. I bring my arms down to the side. I'm going to use an exhale to squeeze the magic circle and an inhale to release. So I always just want to keep a gentle squeeze on the magic circle the entire time, so I'm never just totally letting go. I'm always keeping the inner thigh muscles, the adductors, engaged as I'm squeezing. So there's always a little bit of a contraction that you'll feel there as you're squeezing and releasing. And I also just want to keep my tailbone heavy and the muscles in the front of my hips relaxed. So one way you can do this at home is just to bring your fingers to the front of your hips, and as you're squeezing the magic circle, you want to try to keep those muscles as relaxed as possible. So they're going to work a little bit, but my focus is on my inner thighs. So I'll do about 10 of those, and then I'm going to switch. So this would be a good time if you have a TheraBand, you would now put it around your legs. So before you would have used a ball, and now you would use a TheraBand. If you have a magic circle, you just weave your legs through. Again, I want to find a neutral spine, so my tailbone's heavy. I'm going to press out into the magic circle and then release. And again, I'm just going to do that 10 times. Same idea here. I want to focus on just relaxing the front of the hips and feeling the muscles working on the side of the hips. So that's the glute medius and the abductors of the hip. So again, I do this about 10 times, and then after I finish that set, I'll take my legs out of the magic circle, and then I'm going to grab my dowel. I lay on my back. I'm going to weave one leg over, and the other leg is resting on the back of the dowel. So one leg is over, one leg is under. So I just have some gentle pressure with my hands. I'm going to press, right now it's my left leg, into the dowel, so that turns on my hamstring. And then I pull my right thigh into the dowel. You want to try to not do this so much to where you're tucking the pelvis under and lifting your knees. So you want to keep the left knee right over your hip. Your right knee is not going to be right over your hip, but that's okay. So they're a little staggered. So I'm just doing this push-pull with my legs. I'm pushing with my left, I'm pulling with my right. So I'm engaging my left hamstring and my right psoas. And again, I'll just do that about 10 times. It's a very deep internal feeling when you engage the psoas. So on the right leg, my thought, I'm also trying to relax hip flexors like we were doing before, but it's a very energetic pulling in and down of my leg bone to engage the psoas. So that can be something that's hard to find on your own, and it might be helpful to have somebody assist you in finding that muscle, but for now you can just think about pulling from deep inside of your pelvis and feeling the muscles that attach from your thigh to your navel. So then I'll go ahead and switch. I'm going to wrap my right leg around. The top of my left thigh is against the dowel. I have a gentle pressure with my hands, and I'm almost resisting myself. I'm pushing with my right hamstring, pulling with my left leg, feeling that psoas working on the left side, and then I'm sort of resisting that action with my arms so that the legs don't go anywhere. It's an isometric action. So I do that about 10 times like we did on the last side. If you feel any pain in the SI joint or any discomfort, you want to stop. It shouldn't feel painful. So after I finish those repetitions, I'll take the dowel away. The next one we're going to do is an exercise for the glutes. So we're going to do a shoulder blade bridge. You want to look at your heels, make sure they're lined up right in front of your sits bones. You're going to lie back. Arms are long. You're going to slowly start to lift your hips up towards the ceiling. And I'm just doing a neutral bridge, so I'm not trying to roll through my spine. I'm just lifting the hips straight up to the ceiling. I'm pushing down into my heels and lining my knees up with the center of the hip socket. So my shoulders are heavy, and it feels like there's a hammock through my chest. So my chest is just relaxed and soft, and then I lower down. So you can do this about 5 times, lifting the hips up, pressing into the heels to lift, and lowering down. So that one's pretty simple, so I'll stop there. You're going to roll onto your side next. Place your elbow under your head, bending your bottom knee. When you bend your bottom knee, it just provides a little extra stability so that you're not rocking forward or back. I place my top hand around my pelvis, roll my fingers over the front of my hip. So I'm holding onto that ASIS. Then I want to look, make sure my heel is lined up with my sits bone. So I actually can't see it there, but at home you can lift up, look at your leg, make sure that your heel is in the same line as your sits bone. Another way you can do this is to line yourself up against a wall so that you can feel that nice straight line there. So I'm just going to then rest my head back on my arm, and you can also have a pillow here if this bothers your neck. So I also want to make sure my top waistline is long so that it's not compressing as I'm laying here on my side. From there, I'm going to lift my leg up towards the ceiling and back down towards the floor. And my intention with this is feeling the muscles on the side of the hip like we did when we pressed out on the magic circle laying on our backs. The reason why I have my fingers around the front of my hip is because most likely, if you haven't been doing these exercises, your pelvis is going to want to roll back and your leg's going to want to swing forward. So that's an exaggerated version. But you want to make sure your leg's not swinging forward, so there's no flexion in your hip. As you lift the leg, there's no rotation in the leg. It just lifts and lowers. And then ideally, you should just really be feeling it here on the side of your hip and not so much in the front of your leg. So that's why we also are making this nice long line through the hip so that the hip flexors don't have to work as hard. So I would do about 10 of those. And that's a good exercise for firing the stabilizing muscles of your hip. Do it as well on the other side. I'm not going to show it here, but you can do it that way at home. So once you've done that whole program, we've really balanced out the hips and the SI joints. So now to make it more of a functional exercise, we're going to come up to standing. And you're just going to place your hands at the sides of your hips. So it would be on the haunches of your hips. Bring your feet together and just shift side to side. So I'm not side bending, I'm just shifting my weight. What I should feel is the muscles waking up on the sides of my hip. So as I shift to the right, I feel my right glute medius. As I shift to the left, I feel the left. So then I want to just do a very slight shift to the right, lift my leg, and I still want to feel that muscle working. If you don't feel it working, you might need to shift a little bit more or make an adjustment. Or you might need to see a trainer to help you find that muscle and help you strengthen it. So lower that leg down. Let's do it on the other side. So I just shift until I feel that muscle working. I lift my leg up. I want to feel it working the whole time. I hold that, balancing, and I bring the leg down. So that's making sure those muscles are working when you're standing, which is also going to make a difference as you're walking and as you're moving throughout your day. One more exercise I'm going to show you is in a quadruped position. This one's a little bit more complicated. It's nice if you have somebody watch you do this. You could also take your iPhone, put it somewhere that's higher than the surface where you're kneeling, and videotape yourself doing it so that you can see what your body is doing. I'm going to come onto hands and knees. My hands are under my shoulders, my elbows are soft. My knees are right under my hips and the back of my neck is lifted and long. You want no wrinkles in your neck, so that means that you might need a slight tuck of your chin. And then I want to take the bow out of my back. So my tail is lifted to the ceiling and my ribs are drawn up from the floor. From there, I'm going to imagine that I'm going to move my right leg back, but I'm not going to actually move it back. And I just want to feel how my muscles want to respond. So it's almost like I'm moving it, but I'm not. So I'm just going to do that and just sort of noticing what I feel in my body as that happens. And then I'm going to imagine that nothing's moving in my shoulders, in my trunk, or in my pelvis. As I move my leg, I'm just imagining it right now. And nothing's changing in my hips. And now after I see that happening, I'm going to actually move my leg. So I'm imagining first that nothing's moving as I extend my leg back, and then I'm going to do it. So what you should ideally feel is that there's a lot more stability when you visualize it first. Drag my toes back, and I just keep my toes down, and then I pull my knee under my hip. So do that on both sides a couple times. Every time you come back in with the knee, you just want to lengthen and lift the back of your neck, because what most likely will happen is everything's going to collapse down towards the floor, and so you want to lift your chest, lift the back of your neck to the ceiling. I'm going to add the arm now, so since I did the right leg, I'll do the left leg now. I'm extending the left leg back at the same time. I'm dragging my right fingers forward, and there should be no rolling of the shoulders and no rolling of the hips. So you can break this down into parts, just doing the legs, just doing the arms, adding the arm and adding the leg. For the sake of time, I just went straight to the arm and leg, but it's better if you just take it really slow with these. And then you would do it on the other side as well, so right leg, left arm. And then I just discovered that my hands weren't quite under my shoulders, so you'll find that at home, that if you just move or adjust something, even if it's an inch, it's going to affect the feeling of the exercise and how stable you can be in the exercise. So again, the goal on this one is no rocking side to side, no shifting of the shoulders or hips. So everything stays very stable, as if I had hot cups of tea resting on my spine as I'm moving the arm and the leg. And I just do that part right now. I don't lift up. That'll be in another series. Try those exercises out, see how they feel. If you feel any pain or discomfort while doing the exercises, please stop and see a trained either physical therapist, Pilates instructor, or physiotherapist. If you feel pain after the exercises, it might mean you did too many repetitions, or there might be some exercises in there that don't work for your body. So again, test this out, see how it goes.